So my name is Pam Jenkins. I am a registered respiratory therapist, certified pulmonary function technician, and specialist. I am a certified rehab specialist, cardiopulmonary with CHF specialty. So I do manage our program for our cardiopulmonary specialty here at Chamberlain. And my original practice is respiratory therapy, but I'm not technically practicing as a respiratory therapist anymore. I'm more so managing the disease process that has to do with respiratory pulmonary. What does it mean to me? It means everything. I love everything about respiratory. I love everything about pulmonary. I love taking care of my patients. It's the reason why I show up every single day. They keep a smile on my face, even on the hard days. I've been doing this for so long. I would say maybe 16 years. I'm gonna go back to maybe 2006. I did 8 years of schooling. So I started off as a nurse, and I decided that nursing wasn't for me. I wanted something a little bit more challenging. Not saying that nursing is not challenging, because it is, but on a different level. So I went to school. I found out about a program about respiratory therapy. I didn't know what it was, but one of my girlfriends, she was saying, well, it deals with asthma. So my son was born with asthma. So I was like, oh, okay, I could do that. So that was what started me to go towards respiratory. I'm actually glad I did, because I get the best of both worlds. I get the nursing aspect, I get the physician aspect, and I get the specialty practice. So I wouldn't change it for anything. Gosh, my patients. I love my patients. My patients are the reason I show up every single day. When they can't breathe, they know I'm gonna make their breathing better. And it's the reward of knowing that they can breathe better and that they know me. When they see me coming, the smile that's on their face, that know that I'm going to help them, that, oh my gosh, it makes me want to cry because I love my patients that much. That is the rewarding part of it. It's not the paycheck, it's not the co-workers, it's my patients. Even though I love all aspects of it, but if I had to pick the number one thing, it'd be my patients. I'd show up for them every single day, no matter what. Most skilled nursing settings do not have a respiratory therapist. So being that I'm part of Lower Chamberlain and we have this specialty, it's really a great thing, because we have patients who come here, they have every single type of pulmonary and respiratory ailments, and that's where I come in. I am the person who they meet, I'm the person who does the assessment, I'm the person who creates the plan, and I'm the person who puts the orders in. So here in a SNF setting, if a person comes and they didn't come here for respiratory problems, they came for maybe a hip or a knee, but all of a sudden they develop shortness of breath, then it is the doctor who says, hey, Pam, can you go to look at this patient? And then that activates the services if I need to see them. So I would go assess, talk to them, look at their medical history, and if they're having difficulties, then I pick them up under our service of respiratory and pulmonary. If it's cardiac, they'll come on our service too, because cardiac and pulmonary, they go hand in hand. They're practically related. So when one is acting up, the other one is usually acting up too. So based on that, I put a plan together and I start to see them until they feel better. So myself included, I would have to look in their chart and learn, I call it learning about the patient. Why they went to the hospital, what's their history, do they smoke? I would hope they don't smoke, and then once I learn about them, then I go and meet them. So I meet them, we do an interview, we sit down, we chat, we talk, I get to know them, and then I do a complete assessment. So it's listening to their lungs, checking their oxygen levels, their heart rate, if they cough, what their skin complexion looks like, and then what their symptoms are. They tell me. They got a cough, they're productive, mucus, runny nose, and based on all of that, then I determine a plan. And then once I do the plan, then I implement it with my colleagues, nurses, CNAs, whoever's going to be taking care of the patient. Coming to a skilled nursing setting is actually really good, because that patient and their family gets the whole entire package. Respiratory care is such a big field. You know, it's in high command ever since, COVID. Even though respiratory was always around, but we were like, I guess you would say, the unsung heroes of the clinical care management. But now we're front and center and everyone wants us. So respiratory is something that's going to be around for a long time. It's going to increase, it's a lot more sick people ever since the pandemic. So, if you need a respiratory therapist, just call for Pam. I'll come.